Hi, everyone. Welcome to the World Health Network's Twitter Spaces event. We're going to be letting folks roll on in here. We're going to be talking with Dana Parish and Kaitlin Sundling in a few minutes. Thanks so much for joining us.
I can hear you. Say something.
So glad everyone was able to join us tonight for this very important discussion. We're going to be covering some important topics, and then we're going to move to live Q&A. So we're going to go through some questions that were submitted through our COVID community for the first half, which will be about 45 minutes. And then I'll let everyone know when they can raise their hand to come up and ask questions. So here we are. COVID is certainly not over. We're here to set the record straight, despite all the wishful thinking, the mainstream messaging, and we all are just exhausted with living in this pandemic, but it is, in fact, not over. So tonight we're here to learn and hear from two of our World Health Network members. And they're going to walk us through what is going on with COVID now, to get the facts, and we're going to get some questions answered that's all been on our minds. Before we get started, let me remind you that we have great resources on our World Health Network.global website and direct you there. And make sure to follow us on Twitter, Instagram, and you can also join our network. We have a very supportive network. You can navigate to our contact form on our website. We have meetings every day, plenty of projects to get involved with. So we would love for you to join our community. So let's get started. First, we're going to start by introducing our speakers. We are so excited to have Dana Parish here with us tonight. She is the best-selling author of Chronic, The Hidden Cause of the Autoimmune Pandemic and How to Get Healthy Again. And we have Kaitlin Sundling. But Dana, let's start with you. Can you tell us a little bit about your background and how you got involved with this COVID fight? We really appreciate you coming on tonight.
Oh, I'm so happy to be here. Thank you all. You've been just such a wealth of information for me personally, and I've learned so much by being part of this wonderful network. So my role really in this strange stew of COVID has happened because when I was I was sort of in the height of my music career in 2014, and I got a tick bite, and my whole career and my whole life was derailed. I was a singer-songwriter. I just signed a deal with Sony, and I was writing songs for Celine Dion and traveling all over the world and stuff. And then I just got completely flattened after I got this bite, and I almost died from heart failure. And it took many months to get a proper diagnosis and about a dozen doctors. And I learned the hard way about a wily common infection can do. That's really difficult for doctors to understand and to fix, and there's a lot of controversy. So after my 12th doctor and my millionth symptom, and it was heart failure, as I mentioned, I got better, and I got really angry about the landscape of chronic illness. And I was shocked by how many people had this happen to them at the prime of their lives, weren't being believed, and had this multi-systemic illness that wasn't being addressed. And all these things were being relegated to psychiatric disorders, or people were just put on all kinds of pain medicines and immune suppressants when really they had potentially underlying stealth infections. For me, it was Lyme and another infection called Bartonella, and those can be persistent. And with the right treatment, I got completely better. All my symptoms got better. And I started to write about it for the Huffington Post. And I had no intention of ever writing a book, but I did get this Huffington Post column did well, and it was really shocking to me that people were that interested in chronic illness. And I ended up getting a book deal with my doctor, Stephen Phillips, who's brilliant and saved my life. And I'm so indebted to him. So the two of us wrote this book called Chronic. And, we've interviewed and talked to probably hundreds of scientists. And our book was supposed to come out right as the pandemic hit. And then our publisher called and said, you guys have to write about COVID now. This is crazy. You can't put out a book about the pandemic of chronic illness and not talk about COVID. So we did the book, wrote a chapter about COVID, and really saw the similarities and the overlap between all of these chronic illnesses. Long COVID, we knew that this was going to be a problem for people. Those signs were there kind of early. And so I just feel very dedicated to helping patients and to communicating with doctors as much as I can about what patients are going through. I'm very lucky to get well, so I feel this very pressing need to pay it forward.
Thank you so much, Dana. We are so glad that you're able to join us tonight and for all of your advocacy and all of your work in this space. Kaitlin, so excited for you to be here with us today. You're a COVID Action Group member. Our COVID Action Group is our advisory board here at the World Health Network. And Kaitlin is a pathologist, physician scientist. And if you wouldn't mind telling us a little bit about your background and how you became such a champion for COVID safety.
Thank you so much, Katie. As you said, I'm a pathologist. I specialize in the diagnosis of cancers and precancers. But like so many of us, even those of us without medical training, during this pandemic, I found myself becoming an expert advisor to my family. It was really frustrating to see that my loved ones weren't getting the adequate protection that they needed through the public health measures that were already in place in their workplaces, schools, and communities. I joined the World Health Network because I knew more had to be done. We had to get people the information and resources they needed to protect themselves, because not everyone has someone who can give that expertise. But I knew I couldn't do this alone. I've been really grateful to find a group of people who care and support each other. And I've been able to be a part of work that is really empowering people to make positive changes individually in their communities and globally.
Great. Thank you so much. So, Kaitlin, I have a question for you. Let's talk about BA5. It's predominant here in the U.S. and I've been hearing reports both on Twitter and with folks that I know that have come down with COVID, even for the first time after having been able to avoid it for almost 3 years with the protections that have been working for them up until now. I mean, these are really careful people. So, what's changed? What do we need to know? Is it true that we have twice as many cases this summer than we did last year?
So this is a really challenging situation we're in right now. BA5 is a subvariant of the Omicron variant. As many of you know, the Omicron variant has been different than previous COVID variants, and that has a really high mutation rate. That means this variant of the virus has a lot of changes, so that the subvariants tend to be really, really different from each other. And that's important for a lot of our approaches in the pandemic. So before I get into a few of the scientific details, I want all of you to know that the key takeaway for BA5 is that now is the time to level up your protection and form these habits that are going to protect you now and for future variants. So BA5 spreads really easily from person to person. It's even more transmissible than previous subvariants. BA5 has changes that make our vaccines less effective. And it's important to note that BA5, like all COVID variants going back to the original strain, spreads predominantly through the air. It's really helpful for me to imagine a cloud of exhaled air as being like cigarette smoke. These particles float and hang in the air, and you can kind of visualize it that way. And that's how you want to think about your protections too. We'll talk about that coming up. So the changes that BA5 has make it more likely that you could be infected with BA5 soon after infection with another variant. The vaccines do not stop infection with this variant, but they do reduce the risk of severe disease, hospitalization, and death. So it's really important to get up to date on your boosters and your vaccinations as you're eligible and able. But these vaccines will not be enough on their own. We need our multiple layers of protection for both adults and children to stop from spreading the virus, and that's what we're going to be talking about more tonight.
All right, great. Dana, do you have any comments regarding what you've been hearing about BA5 from your perspective?
Well, I have been blown away by how many of my scientist friends and acquaintances have expressed concern about its transmissibility. I know Kaitlin just touched on that. The other thing that is concerning is that we're seeing so much more outdoor transmission, and outdoors was always sort of the great bastion of hope for many of us. We could still socialize and feel pretty safe sitting at a table a few feet away from friends. And now I think that these parameters have gotten a little bit more stringent, a little bit more different, unfortunately. Yeah, I read a tweet from a physician, I'm sure many people here saw it, where she was walking her dog and had a brief interaction with a stranger and got infected. So those kinds of stories make my blood run cold, to be honest with you. But I love talking about what we can do to prevent infection, because I think there's so much focus on just suck it up, you're going to get it, and too bad, and it's just going to be the way it is. And that is not the way I look at this at all. You know, I really think that if you take some moderate steps you can really avoid being infected, and especially reinfected over and over and over. My personal way of living in this period of time is that I do all social stuff outside, and I wear an N95 whenever I have to indoors and share air. I limit my time indoors in crowded public places, supermarkets, those kinds of things that I must go first thing in the morning, because as Kaitlin pointed out, airborne infectious virus lingers in the air for a long time, like smoke. And if you think about it like that, even when somebody left the room, if they've been in there for a while, breathing, talking, just being alive, being a human being, their infectious aerosols can infect you a half hour after they left if that room is not very well ventilated. So I just hung up with an aerosol scientist a couple minutes before this call, and I said, what is the recommendation now? Say you have some people in the home, working in the home, and you don't want to get infected if one of them is sick. People are not wearing good masks if they're wearing them at all. We have to assume there's no protection. What's a good amount of time? Air out the house. Maybe an hour and a half, 2 hours. I don't think that's crazy right now, given the incredible risk of contagion and the incredible risk, in my view, of long COVID. I am not worried about the initial infection nearly as much as I used to be, because the variants have changed and they're less pathogenic up front for the most part. In many, many cases, people are not just dropping dead like they were in March, April, May, even February and January in other countries, the way they were. There's still always the threat of a long-term chronic debilitating illness, and each infection is Russian roulette. So I just can't emphasize enough that I don't think you have to agree to keep getting this. Take some simple measures, and you can be much, much safer, and so will your kids and your family.
Thanks, Dana. Now, we all, some of us know that the U.S. did have a pandemic plan that was pretty robust to begin with. And what happened there? What happened to that plan?
We failed. We completely ignored it. We had a great pandemic plan. It included the use of respirators. It included repurposed drugs. Johns Hopkins Center for Health Science rated us #1 in preparedness in the world, and yet we have had the worst outcome in the U.S. That is shameful. We stressed the importance of an early health response, but we were not given an early health response. We were not given the precautionary principle. That is so important. If you don't know if a virus or a pathogen is airborne, let's pretend that it is until we find out for sure. That wasn't the case for any of us. We were told, don't wear a mask, wash your hands, keep your hands clean. There were all kinds of important warnings that were ignored, and the dire consequences of the federal government abandoning its role ended up leaving states to fend for themselves, and it just became a mess. There was limited budget. The budget for all of these health measures just kept going down over the decades. So we've just kind of been left in a very, very bad place by not starting off with a really, really strong leader saying, look, this is possibly airborne. Here's what we're going to do. You do need masks. We do need to take this seriously. And, that it just sort of went haywire from the airborne denial and all that. It's been really the worst of it.
Absolutely. So I know in my own circle, Dana and Kaitlin, I have becoming more and more of the outlier, doing all these things to protect myself, and even doing more now in the past few weeks with BA5 being so much more contagious. And some of my friends and family are just like, why? Why are you doing this? And it seems like we really need to go over again. Why do we want to avoid COVID? People say, I already had COVID. I did okay. It's not a big deal. Or people are still saying it's just Omicron. It's mild. But Kaitlin, can you tell us about why it is so important to avoid infection and especially avoid reinfection?
This is really key, and the pressures that you described, all of us are facing. We're in this together, even though we don't see all the other people taking these precautions. And we're going to talk more about that later, too, the importance of social support. But the reason for taking these precautions, there are so many reasons, but I'll just list a few of them. So first, even if you had COVID before and it was mild, it might not be a minor illness now. Each time you're infected, there's another chance that something more severe could happen. We know that each infection can cause damage, and each infection increases the risk of long COVID and the potential for permanent organ damage. All of us are vulnerable. There's been so much talk about people who are high risk, and yes, people who are at high risk of severe disease definitely need to protect themselves, but we all need to protect ourselves because these effects of COVID can be really damaging, even for people who were previously healthy. And then for those people at high risk of severe disease, including those who have chronic illnesses or disabilities, they should be able to fully participate in society, including all of the things that they want in their lives. All of us should be able to participate, and using a multi-layered approach makes it safer for all of us. If you spread the virus, you don't really know who you might spread it to. So you want to reduce your risk of spreading the virus as much as possible to protect your loved ones and your community. No one is safe until we're all safe. And then finally, if you take precautions, you're likely to be exposed to a smaller amount of the virus. This is really tough to study scientifically and experimentally, especially under these sort of emergent circumstances, but it really makes good sense that a small amount of exposure is likely to lead to a less severe infection.
Well, thank you so much. And I just want to welcome anyone that just joined on. Welcome to the World Health Network's Twitter space. Today we have Dana Parish here, best-selling author, and Kaitlin Sundling, a physician scientist. We are talking about protecting ourselves from COVID, especially this much more contagious variant BA.5. We're going to be getting into how we can protect ourselves and the different layers of protection. So before we get into that, Dana, could you comment at all about why we should be protecting ourselves from your perspective?
Sure. I mean, one thing that I think has been a mistake from the beginning is to delineate who is high risk from who is low risk, because we know that long COVID affects many, many young and healthy people. So there is no way to get chronically ill more quickly or immune compromised than to get a really bad run of COVID. And it is Russian roulette. I've seen more young and healthy people go down than anything. That is exactly what happened to me. I was at the prime of my life. I'm going to say it again. I was at the prime of my life. I was so happy. I was healthy. I was the prime of my career. And boom, who knew that an infection could cause a multi-systemic illness that nobody understood and that resulted in near death and heart failure. And this is so much what I'm seeing with long COVID. I don't hear from people in their 60s and 70s and 80s. I hear from people in their 20s and 30s and 40s. I hear from parents who have 8-year-olds with brain fog. I am very concerned at how this isn't being taken seriously. And again, one really important thing to mention is latency. This is totally key. And it's been, as I've said many times, the elephant in the room. You don't necessarily get an infection and then never get better. You might feel better for 2 months, 3 months, 6 months, and then boom, you wake up one day and your whole world has been rocked. You could have a multitude of different symptoms. They could be migrating. You could have strokes. This is a vascular disease. This can cause brain damage. This can cause lung dysfunction. This causes microclotting all over the body, all the different organs. So I've talked to pathologists. I interviewed Dr. William Lee for the book. With Dr. Phillips. And he said that the first images he saw, tissue of people who even had mild disease, were stunning. I think he called it bone chilling. So why this message isn't getting through, people aren't more concerned about this, I don't understand. I think there's just this concept that it was like a cold. Yes, that might be true in the beginning, but then you might get really, really sick down the road.
Thanks, Dana. So the World Health Network has put together a really clear and helpful graphic that is also on our feed. It's called the 5 Pillars of Protection. So we're going to take a few moments here with Kaitlin and review these pillars because, as we all know, we have to up our game. So let's start with masks. Could you take us through different types of masks and how they work?
Thank you. So I mentioned earlier that COVID is airborne and spreads through the air smoke. This is why it's really important to wear well-fitting masks that to your face. A loose mask with gaps around the edges is not going to protect you as well as a mask that has a really good fit and seal. So although I'm not the mask nerd, that would be Erin Collins, I am definitely a bit of a mask nerd. And there are some side benefits that I just wanted to highlight. I really love that I haven't had any respiratory infections in the last 2 years. My mask has protected me really well from that. And my seasonal allergies are better too. I actually wear an N95 or better mask whenever I leave my house. That makes it a really easy habit to maintain. It's really easy to remember, and that's what makes this easy and achievable for me. So one great question that came from our Twitter COVID precaution community was about upgraded mask options for those especially who have to return to in-person work or who are headed to school in the fall. Some people are surprised to know that N95s or FFP2 in Europe are not necessarily the highest level of protection for adults. N99s or N100s or P100s, those are the equivalent of FFP3s in Europe, whether they're disposable or elastomeric, are an upgraded option that provide a greater degree of filtration. But with all of these options, the fit is incredibly important. If you have any gaps around the edges, the air is going to come in around the edge rather than passing through that really great filter. For young kids who may need smaller sizes, N95s aren't made in child sizes, so KN95s or KF94s are great options. It's important to note that counterfeits can still be a problem, so I really highly recommend using a reputable source such as Project N95. With Project N95, they vet all of their mask suppliers, so you don't have to worry that you might be getting a counterfeit mask. We've talked a bit about mask testing and user fit seal checking. That's really important. I would refer anyone interested in those discussions to our previous Twitter space discussion with the mask nerd, Erin Collins, for more discussion of adult and child masks. With any mask, I would really encourage you to not think about your mask as an impenetrable barrier. You should not enter an unnecessarily risky situation just because you're wearing one of these better mask options. These masks really work best for protecting you and everyone when everyone is wearing one. That universal masking is so important. This reduces the potential virus in the air, and the effect doesn't just add, it multiplies. And this protection also works best just generally when concentration of virus in the air is not too high, and that's where air quality comes in. There are definitely necessary activities where you can't wear a mask if you need to eat or drink, or if you need to go to the dentist. We have a new guideline on going to the dentist, by the way, and we'll share that. That's available on on the World Health Network website. So whenever you're doing one of those things where you can't wear a mask, you definitely need to amp up the other layers of precaution. And in addition to wearing a mask, we recommend that you wear eye protection whenever you're at risk of being exposed to COVID, either some kind of safety glasses with side protection or goggles that actually seal around your eyes.
Thank you. That was super thorough. We have another question here from our COVID community. So what about mask mandates now? Like, what is the role of mask mandates, and what can I do? What can people do to support mask requirements, say in the workplace, locally, nationally? Do you have any information on that, Kaitlin?
So what we're seeing now is that there's actually a return of mask mandates with the BA5 wave, and this is very promising that that this protection can come back. So we know that mask requirements really support that universal masking that protects people, and this approach, this universal masking approach, is really especially important for essential services like healthcare, grocery stores, pharmacies, as well as in workplaces where people may not have the option to work from home. So we've seen the return of mask mandates in a few places, and I'll just list a few. Los Angeles County starting July 29th, the San Diego Unified School District, city buildings in Cedar Rapids, Iowa, and for city employees in Lincoln, Nebraska. So a lot of different localities we're seeing the return of mask requirements, which is really great support to make it safer for everyone. It's important to let leaders know that that's what you want, that you want a mask mandate, and that would make it safe for you to participate in work and in other activities. So you can let your state, local, and national leaders know, as well as school districts and businesses, that you want mask requirements. You can do this through just informal conversations, but also letter writing, things like public comment at government meetings.
Great, thank you. Can we talk about air quality? Dana, can you comment on air quality?
Absolutely. Well, I support everything that Kaitlin just said. And, you know, I remember early in the pandemic watching, I call her like the queen, the superhero, Professor Kim Prather, who I just admire and just, appreciate so much her voice in all of this. I remember seeing her do an interview for CBS early on, and she said, infectious aerosols can fill a room like smoke and linger in the air for hours. I still get chills when I think about that because it just changed my view on everything. It was the catalyst for me leaving New York City and knowing I couldn't live in a high rise at that time because New York City was in such dire straits at that time. So I've learned a lot from Kim and from many aerosol scientists over these last couple of years. And one of the most important takeaways for me was filtering the indoor air, not only for COVID and for infections, but for pollution and wildfire smoke and allergens and mold and dust and asthma and all kinds of things. You know, it has all kinds of benefits. I don't know that filtering, I don't think clean air should ever be politicized and controversial. For me personally, I use air filters. I use portable HEPA filters. I open windows indoors. I live in California now, so whenever possible, I always have my even if it's freezing cold. Even when I lived in New York my whole life, I always just inherently had the windows open. I just felt like fresh air was better. But you know, as I've talked to more aerosol scientists and learned about schools and classrooms and how to help them if they don't have any windows or natural ventilation, just make a few Corsi Rosenthal boxes if you can. My friend Sri, who is a wonderful scientist, many of you probably know, he works a lot on air filters. He has a website also called patientknowhow.com. And he tells you how to build also a really inexpensive your own filter. So, you know, this gold standard for an infectious disease, like a room in a hospital where they're dealing with TB, is 12 air changes per hour minimum. I know that's like really hard for people, even me, to conceptualize. Like, how do I know? I would just say, you know, more is more. More ventilation is more. If you feel the air is still, get it moving. Get some fans. Get some filters. Open some windows, and give it time to air out before you enter a room. If people have been in your house and they're not wearing an N95. I feel really strongly about that.
Thanks, Kaitlin. From a physician's perspective, could you add what your knowledge is in the importance of keeping the air filtered?
I just really appreciate everything that Dana said, and only a few things to add. I would add also that CO2 monitoring can help you figure out if exhaled air is accumulating in a space. And then I would also point people to our ventilation guideline at the World Health Organization. The other thing that I want to point out in this multi-layered approach is that these improved air quality options don't negate the need for masks. So this is particularly important when people are close together. You can imagine the exhaled air like cigarette smoke kind of passing people. Even if you're outdoors with ideal ventilation, masks are important when people are together.
Thanks. So we're going to move to the next pillar, which talks about the importance of social distancing. And we did touch upon this in the introductory comments that social distancing has needed to shift. And maybe, Kaitlin, you can start us off with explaining the different levels of social distancing for different situations.
Yes, I think social distancing is kind of the most underrated and most misunderstood pillar right now. Really, the best option for gatherings is to not physically be there. Virtual options are really awesome and they can allow you to connect with people while staying safe. They can also make all kinds of gatherings, whether it's conferences, work meetings, social gatherings, more inclusive for disabilities. They can reduce travel time and other costs and allow flexibility and convenience for a variety of reasons. So there are a lot of side benefits. So I really appreciate virtual options to provide that social connection, which is so important. And we're going to be touching on this again later. So if you have the opportunity to advocate for virtual option, I would really encourage you to do so. Distancing also applies to physical distance, and that's for those in-person gatherings or in-person on-site work in a workplace. So the more distance, the better. Now is a really good time to unlearn that 6-foot rule and instead think about greater distances as providing even protection. Masks, again, are really important when people will be near each other, regardless of whether you're outdoors or whether you have ideal ventilation or filtration in the room. And whether you're indoors or outdoors, using a larger space for a smaller number of people will be helpful when you must gather in person. Again, we need all of the pillars together to get the best possible protection.
Great, thank you. Dana, would you like to comment?
Yeah, I just wanted to say something that I forgot to say about air, which is there is a difference. Caitlin kind of jogged my thinking about this just now, is that there's near field transmission and there's far field transmission. So when you ventilate your home, and you know, I was just talking to an aerosol scientist right before this call about this specifically. Like I said, what would be comfortable if you knew it's a possibility that somebody in the room, you know, could have COVID and you were going to have dinner with them and you had to do it inside in their dining room. How many feet apart? If it's really well ventilated, and we get that, you know, 6 to 12 air changes per hour going. How many feet apart? He's like 8 or 9. No, he said nothing is foolproof, but for far field transmission, that's pretty good and pretty hopeful. But if you're sitting, you know, there's this whole, you know, notion that the air on the plane is so clean. And well, how many of us have seen people hold up their CO2 monitors and there's a terrible reading? And you just go, that air is not, that's a lot of rebreathed air. So there's, you know, you're sitting next to somebody on a plane. That's why you want to wear an N95. Ventilation is always important, but you really have to understand when you're having a face-to-face conversation, there's nothing that's going to save you except, unfortunately, I know this is, nobody wants to hear this, but wearing a really good quality, well-fitted mask. That is the bottom line. And I'm really sorry how much, you know, this has become such a political nightmare and such a divisive issue. And trust me, there's nothing I'd love to do more than freely live my life without ever seeing another mask. But I just understand the value of it after all this time. And I think it's really important not to dismiss the incredible benefit that it can have if we are all taking that very seriously.
Thank you. I just want to remind the audience that we will move to live Q&A in about 20 minutes. So you can hold off on requesting, but you can think about questions that you might have now, but we will be getting to that. So please keep that in mind. So next we're going to move to surveillance and testing as our third pillar. So if you can go ahead, Kaitlin, and start us off with going over the importance of surveillance testing.
So surveillance testing are both really important to help identify people who are infected with COVID so that they can isolate and not spread the virus to others. In addition to the testing options that we all know about, a really important piece that's kind of undervalued is having people stay home when they're ill, even if having minor symptoms. If you think it might be allergies or anything like that, they should stay home and not gather. So rapid antigen testing is usually done at home, and then we know the other options are PCR or molecular tests that are often done in clinics, pharmacies, and other testing sites. So rapid antigen tests are those tests that look sort of like a pregnancy test, and those can also be called lateral flow tests. These rapid antigen tests now are somewhat less reliable because the part of the virus that's being detected by this test has changed a lot. That's the many mutations that you've heard of. And also the recent variants have shifted where they like to live in the body, changing from the nose to the throat. So depending on how well you sample and where you sample, you might not be able to rely on these tests as well. So some public health recommendations, such as Ontario Health in Ontario, Canada, recommend swabbing your throat first, followed by nose for rapid antigen tests. Home molecular testing options do exist, and those perform nearly as well as PCR testing, but they're more expensive in general than rapid antigen tests. So keep in mind all of these options, whether it's the rapid antigen tests that you do at home or testing that's done in a clinic or a lab, you can have a false negative test. That means you may be infectious, but your test may come back negative. These misleading false negative tests are more common with rapid antigen tests, but they can also occur with PCR tests and the other types of tests that look for the viral RNA. A really important thing to know is that a positive test by any method should always be trusted, and you should definitely isolate right away. By the way, our isolation guidelines are available on the World Health Network website. And following a positive test, we recommend isolation for at least 14 days with also resolution of symptoms, as well as 2 negative tests 24 hours apart to exit isolation. It's really clear now at this stage in this pandemic that 5 days of isolation is not enough and it's not working. That's unfortunately putting people at risk.
Thank you. And we have our final pillar, which is vaccination. So how does vaccination fit in with the rest of the protections, Kaitlin?
So vaccination is a really important individual protection. Now, with our immune-evading variants, such as BA.5, vaccines provide mostly a reduced risk of severe disease and hospitalization. Vaccination does not eliminate your risk of long COVID, although it can slightly reduce the risk. It is well established that vaccinated people infected with COVID can and do transmit the virus to others. So vaccine mandates or requirements without protections from the other pillars are not enough to stop the spread of COVID. I like to think of vaccines as our last line of defense. This is really important when you might get exposed to the virus. Despite your best efforts, if it's a really small amount, hopefully that vaccine will take care of it and help protect you from those severe consequences. I want to give you an idea of how I'm thinking about vaccination, so I'm going to share something personal with you. As a healthcare worker, I got my first booster back in the fall of 2021. I'm not eligible to get a second booster because they're not yet available for people under the age of 50 in my area. I'd hoped I'd become eligible soon, but whether or not that happens, I'm actually not going to change what I'm doing to protect myself and my family. I still don't want to be infected with this. I don't want to spread it to others, and I really don't want to be at risk of being seriously ill or having long-term damage or long COVID. So in addition to vaccination, multi-layered protection from those 4 other pillars is really needed to prevent the virus from reaching you in the first place and to reduce your risk of infection and damage from COVID.
Thanks, Kaitlin. Dana, would you like to comment on vaccines?
Sure. Well, first of all, Kaitlin kind of said it all, but I'll just add that yesterday, some of you may have caught the White House had, I guess you would call it a summit about the next generation vaccines. And I saw Kiko Osaki there, who I think has captured the attention for a lot of attention for working on a sterilizing vaccine, which would block transmission. And she ended the conference by saying, this is the way that we will really end this pandemic, and this is the way we will stop long COVID. So I'm really, really excited about how many of these are in development. I hope they get the full support of federal funding and private funding, whatever they need. But I will be first in line to protect myself from infection blocking, long COVID blocking. And, I think we need that tool very, very badly. And I'm excited that there are so many scientists that agree. I heard Tony Fauci give an interview earlier this week saying that's what he is hoping for and praying for. And I'm on it. I'm all over it. I'm really excited. I'm following it closely and cheering it on.
Thank you. And I just want to remind everyone, thanks for joining in. If you just came on, we just finished up talking about the 5 pillars of protection. There is a nice infographic right there on our Twitter feed, and we also have more explanation on our website. And now we're going to be talking about reinfections and the higher risk transmissibility of BA.5. So first we'll talk about reinfection. So, I've been hearing about people getting COVID back to back as soon as even 1 month apart. Can you explain why this is happening? Like, you get reinfected and sick by the same variant twice. These are some common questions that have been coming in, and personally, I have myself.
This is definitely a difficult problem right now. You can be reinfected right away with a different variant because of those changes in the virus that are really frequent now with Omicron. It's been shown even that people can be infected with 2 COVID variants at once. So multiple variants are circulating in the US. BA.5 is predominant, and that's what we've kind of focused on today as the predominant variant. But we also have BA.4 and the BA.2.12.1. That's very difficult to say. And we're seeing new variants emerge all the time. So most people will never know what variant they were infected with. From a laboratory perspective, I think that's one of the most misunderstood things. You don't get to know your particular COVID variant may never be identified as whether you had BA.5 or BA.4 or something else. And then if you're exposed to someone who has COVID, then of course they also won't know which variant that they had, whether that's the same one or a different one. We know that antibodies from previous infection fade over time. It's likely that reinfection with the same variant could occur, although that scenario is really less likely from a practical perspective because of the multiple variants circulating right now and new variants emerging.
Thanks. Dana, from your perspective, what are you seeing in your circles?
I'm seeing a lot of misinformation being spread, unfortunately. Like there is still the idea in my experience, a lot of people really don't think that infections can happen so closely together and are shocked when they do. And I always feel very sad about that, because there is stuff now that we do know that can happen. And I think that people should really be made aware of that. I don't think protect yourself properly without the actual scientific information. And there's so much controversy around saying anything that is not like happy, great, news. But I think that the best thing we can do is be transparent and honest about what we know and what we don't know. I have seen people, including people that I know well personally, get infected within 4 or 5 weeks of their prior infection. And I have seen all of them be quite shocked. And so I would love to just make sure we emphasize that it is possible, and that you should, if you don't want to be reinfected, just wear your N95 inside, ventilate as much as you can, socialize outdoors. I don't think any of this is that difficult, but it's just been made so political. And I think there's been so much anger and division over the confusion and misinformation that has been put forth that a lot of us are we're just tired, exhausting. But I think we're going to get through this more easily and quick if we do these things.
Thank you. So, we have basically what we're living in is the Beyblade let it rip strategy, where this is just not being controlled and people are now suffering from multiple infections. And I would love for you guys to talk about, again, the impact of repeated infections, especially how does that affect your chances of getting long COVID? I've been hearing about the more infections you have, the more likely you might get long COVID. Is that true from physician experience and research? What have you been reading, Kaitlin?
This is so important. And I think one of the questions that people in our communities face is this idea, well, isn't everyone going to get it? Aren't we all going to be infected? So what's the point of taking precautions? What we just talked about, this risk of reinfection is so crucial. And the risk of long COVID is cumulative, so that we know that reinfections cause additional damage each time that you're infected. So each reinfection increases your risk of long-term damage. So discovering new damage from COVID all the time, it's actually really hard to list organs in your body that aren't damaged by COVID. It's kind of hard to think of that. So, you can kind of look at the list of long effects and see which things are most important to you, which functions of your body are really important. For me, vision is particularly important for my job and for my life, as is brain function. Both of those can be damaged by COVID. And then damage is not limited to solid organs. There's growing evidence that COVID can damage your immune system and may lead you vulnerable to allergens, repeat COVID infection, and potentially even cancers down the road.
Dana, can you talk about the autoimmune and chronic illness aspect of this?
Yes, I can say that what has been interesting to me, and is a great parallel to my experience with having Lyme in 2014 and 15, is that people don't mention a lot of times their symptoms to their doctors because they think they're just going to go away. And there are also a lot of weird symptoms, and sometimes they're embarrassing symptoms. People don't like to talk about things that are going on in their brain because they don't want to be called crazy. Maybe they have a new onset of anxiety or depression or OCD. I noticed, so it's so interesting because, I start asking people sometimes after a infection, how are you doing? Everything okay? Did you have any lingering symptoms? No, I'm just tired. Or no, I just have had a little bit of joint pain. And I've been having a lot of trouble sleeping. But this is kind of what it can be. It doesn't have to be, I had a heart attack walking down the street. It doesn't have to be like that. I think that the thing is, it can affect, as Kaitlin said, any system, any organ. It can damage any part of the body. And every time you get infected, it's Russian roulette. I don't know that there is a magic answer for who will get this, who will not, who's predisposed, who will not. There are some clues and ideas, and that's great. But I just think it's impossible to know. I have a close friend who had a stroke, who was young and healthy. I have another close friend who had to have a defibrillator put in because he had AFib. I have a family member who went blind in one eye from a blood clot. So I'm just saying, among just close people in my life, I've seen horrible ravages of this virus and terrifying things. And that's why I advocate so strongly to educate people about it, because I think it's really the main event is the long-term stuff right now. That is what is going to be, at the end of the day, the thing that so few paid attention to, that we should have been looking at. That's what I'm most in fear of, is the disabling of the world. And I'm not saying it's going to be everybody. I don't think it's going to be everybody, but I think it's going to be too many people, and it's heartbreaking and it's crushing. And I have no skin in the game other than to say that I think it's a crime against humanity to have let this happen to the world. And I can't sit idly by and pretend that it's normal and pretend that it's okay. It's devastating. And I'm very, very upset by it. As many of you know, I'm talking about it all the time. And I'm talking about it because I really care that people don't put themselves in harm's way when they don't have to. I don't like seeing all this minimization of this deadly, airborne, brain and organ damaging, sometimes destroying, vascular damaging virus. That's what it is. Let's call it what it is. That is what it is. When I say airborne brain damage, people get angry and people get upset. It's so dramatic. It's too much. No, it's actually the truth. And the truth is horrible. And that's why you should be paying attention. That's what I have to say about it.
Absolutely. Thank you so much. Couldn't agree more. Kaitlin. Let's move on. Yeah. Sorry, let's talk about community support in a moment, but I just want to let the audience know that we're about to move to taking some Q&A questions. So start thinking about your questions, and you can request to speak. We have 2 more topics to go through, and then we will be looking forward to taking your questions live. So I'd like to talk about community support. So we're talking about all these ways that we need to be more careful, and honestly, that does reduce our opportunities for social engagement in traditional ways. But it is important to have these social connections. It is important for our mental health and our emotional well-being. So can we talk about ways that we can safely meet our needs in this way?
Yeah, this is so important. I just want to say that I really love Dana's passion about this. This is one of the things that we do, is share how we feel about this and share how important that this is to us. So it's really important for everyone listening. If you're taking precautions, or if you're thinking about taking precautions, you are not alone. We might not see each other out and about in our daily lives, but there are so many of us. There are already thousands of members of our communities, both the Twitter precaution community and our website, covidmeetups.com. We've got thousands of people there, and those communities are growing amongst many others. And there are tons of people who haven't found us yet. So I'm grateful for all of you who are listening. By taking precautions, you are a leader, you are a role model. Others may be interested, but if they don't see others taking precautions, they might not be brave enough to. And also, it might not seem like much, but by supporting each other in groups like the Twitter COVID precaution community, like covidmeetups.com, you can really help other people in feeling less alone. It really helps. Every day I meet someone who had no idea there were so many others out there still taking precaution.
Dana, could you add to that, and can you talk about some of the community opportunities we have?
Sure. I mean, I always think of it like, for me personally, I feel this tremendous pressure to just go along. I feel pressure. I'm always getting invited to things that are uncomfortable for me to go to, and I have had to, unfortunately, I like to joke with my newfound friends in California. I've known only since the pandemic. Like, I used to be a social dynamo, but really, I did love to be super social and go out and do fun things all the time and hear music and in cramped, airless, smoky clubs. And those days are over for now. So I say, be a leader. Don't follow the herd off the cliff, because at the end of the day, if you are healthy and you feel good, that is all that matters. I can't do the number of people that I know who have trouble breathing now. Really close friend of mine has burning lungs all the time. It's been almost 2 years. It's not worth the risk. to succumb to the pressure. I feel it too. I don't like it. It makes me uncomfortable. I hate saying no to things that sound awesome and fun, but I just play the long game. And I really encourage people not to be afraid to just say no or to be the one to show up with the N95. I think that's great too. But there's a tremendous pressure to conform and to not take any precautions. And there is a certain faction of people who have written about the pandemic in the past tense and talk about it like it's over. And I wish to God that it was, but that's just not the reality. And in fact, the more we deny it, the more we are fueling it, and that's really, really difficult to watch.
Yes, absolutely. And we are a community that holds hope, and we come together and we support each other, and we can find others that are like-minded and be a good influence, like we've all been saying. Kaitlin, can you give us some of your views on hope and what it means to you in this day and age?
So hope is so important, and this keeps coming up in discussions with all kinds of people in these communities. What are we hopeful about? And I like to think of it as hope without hopium. So we can see the situation as it is. We can see the reality. We can see the challenges. We can see the problems. We don't have to deny those things to still feel hopeful. And the great hope that I have and what inspires me is knowing that individual actions can make a difference and can inspire a larger change. So how about instead of thinking about going back to normal, how about we can think about what's next? Collective actions can not only stop the spread of COVID, but can help us build a future that's kinder, more inclusive, and safer, a future that's better for all of us.
Thank you. So before we move to Q&A, any closing words, Dana?
Well, it is sometimes a struggle to remain hopeful in these days. So I would be disingenuous if I said that I was filled with hope, because I see so much division and I'm so sad about it and so upset about it. But that said, I do think that we just really hope and pray that somehow we can all come together and we can bridge these divides by seeing the benefits of doing so and of protecting each other, and seeing the outcomes when we wait. When there are these, I really do think and hope that there will be sterilizing vaccines that will block transmission of the virus and block long COVID. I really think we should hold out for as long as we can, getting infected and reinfected for those. I don't think it's, hopefully it's not going to be too long. So that's my hope. My hope is that we will have, right now we have ventilation, we have masks, we have vaccines to reduce severity of illness. But the non-pharmaceutical interventions are very key to reducing long COVID and to reducing infection. And that's what I personally rely on so much to keep myself safe.
Thank you, Dana. I would like to remind everyone that Dana has a book, Chronic, The Hidden Cause of the Autoimmune Pandemic and How to Get Healthy Again. Please check out her link in bio to find that out. And we have great resources on our website, worldhealthnetwork.global. We have infographics that you can share with family and friends at the workplace that will be helpful. And I would like to remind everyone that we are now going to move to questions. So if you would like to ask a question of our speaker, please go ahead and request to speak now. And we will start with Eric. Go ahead with your question. Eric is connecting, so just give him 1 sec. Hi, Eric. We can't hear you. All right, we can move to another question if anyone would like to ask.
I have something I can add if
Okay.
while we're waiting. One thing I want to talk about is asymptomatic. I've learned a lot from friends who are epidemiologists, and I never really thought about this too much in my prior life, but I learned so much about asymptomatic infections that are driving the pandemic, and I think people don't think I think people count their infections by how many times they've been symptomatic, and they overlook asymptomatic infections and how they are why probably we're still in this pandemic. I think when people are sick, they know they're sick. They can stay home. But I think the asymptomatic infection, you can still get long COVID if you have an asymptomatic infection. I've heard it from so many people who, because they're healthcare workers or they work in some sector where they're getting tested a lot, and they find out they had an asymptomatic infection. They feel fine. They don't treat. They don't do anything. Well, we should talk about treatments too, because I think that's super, super important. But I think we should take those, we want to prevent that too, because it's not risk-free in terms of long COVID and also in terms of spreading.
Thank you. Could we talk a little bit about outdoor transmission? Kaitlin, could you go over that? I'm just hearing about how it used to be pretty safe to be outside doing activities and feeling like you're not going to get COVID, but now I'm hearing some about catching COVID, even being outdoors.
Yeah, this is really an important issue, particularly now we're in the summertime in the Northern Hemisphere. A lot of activities are outdoors, and people have chosen to do things outdoors because that's been the safer option. But there's been a bit of misunderstanding between 100% safe and safer, and outdoors is safer. It has nearly ideal ventilation characteristics, basically. If there's a breeze that can help disperse the airs in the area and kind of can reduce the potential for exposure. However, there is definitely a risk, and the risk has been there with these highly transmissible variants. When I think about my concern for outdoor transmission, it really started back with the Delta variant, with that highly transmissible variant. And that's when I started to really get serious about masking, even when I was outdoors. I actually mask when I leave my front door when I'm walking my dog. I walk on some wooded trails and some narrow sidewalks, and I might be passing someone. And I really think it's polite and a good neighborly thing to not breathe on other people in this day and age. And I also want to be a friendly neighbor. I don't want to have to stay at a huge, huge distance and be afraid of talking to my neighbors if I run into somebody. So I wear my N95, and I do stay at a reasonable distance, but I can stand and chat with my neighbors as I feel comfortable. And I think that a lot of people are finding that COVID transmissions are happening in outdoor events. It's important to still take precautions. So that's that multi-layered approach. So we have good air quality outdoors, but we need to invoke other layers. So you still wouldn't want to gather with someone who potentially has a COVID infection, even though you're gathering outdoors. And you also want to bring in masks and the other pillars as best you can with outdoor gatherings.
Thank you. Greg Howard, would you like to ask a question?
Yeah, sure. Hi, thanks so much for speaking. I'll disclose I am a volunteer with WHN and part of the community here, but I wanted to ask a question that seems like it's been on the mind of many folks who are looking for those ways to maintain their social connections with those who are not taking COVID as seriously. How safe should we feel these days in trying to have those social gatherings where folks are not willing to mask, but perhaps they'd be willing to take a rapid test, an antigen test, before getting together? Obviously, those are only good for so long. They represent, a point in time measure of viral load. But if a person isn't showing any symptoms and they're willing to take a rapid test, would you be willing to get together with them indoors for, say, a 2-hour dinner?
Would like to take that, Kaitlin.
Yeah, I could take that. Thanks, Greg. That's an excellent question. That's something that comes up in our communities, people that I'm talking to quite frequently. With the limitations of rapid antigen testing, I would not trust that as an only measure to keep you safe when you're gathering with someone. I really would incorporate other pillars like masking, like distancing, and ventilation filtration to keep you safe in those gatherings, because those rapid antigen tests do miss some active infections.
Thank you. Elias, would you have a question?
Yes, hi. Thank you. Just wanted to also say I appreciate the space a lot. But wanted to ask in terms of masking, what and forgive me because I came in late if this was already covered, but what precautions should I keep in mind? Because I stayed, at home and generally safe, but and like strictly safe, but wondering like if someone's inviting me or something, like what other things should I look for that could potentially like make my mask not be as effective, if that's something that can be spoken upon. Thank you.
Kaitlin, would you like to take that one?
Yes, I would love to talk about that, and thank you for this question. The fact of the matter is that your mask will work no matter what, but masks are not perfect. And I said earlier, I like to not think of masks as an impenetrable barrier, as if we could just get the best possible mask, then we'd all be able to go about our business as if nothing else is going on. We need those other pillars of protection. A big one is making sure everyone else in the gathering is wearing a really high quality, high filtration mask. And then those other pillars, which are available on our Twitter feed, the World Health Network's Twitter feed, the other pillars, if you can add precautions from those other pillars, if you're the event, you have some control. If someone else is, hopefully you can ask them and at least let them know that's what you'd like. You'd like people to be taking additional precautions, and you'd like additional measures to improve the air quality in the space if you're good.
Thank you. Health Nerd, would you like to ask your next question?
Hi there, my name's Heather. I go by the Nerd. Just to preface my question, I'm currently sick right now with COVID. It's our first time as a family getting it, and we've been so careful with N95s and HEPAs and keeping our daughter even out of school. Excuse me, but we let our guard down with one family one time, and so we regret that. My question is about my daughters and I guess our subsequent risk. I understand that there are a number of variants that are going around right now. We don't know yet what kind we had. And she's going to an overnight camp next week. And they are going to be testing everyone beforehand and so forth. But and obviously she'll be negative before she goes. But I'm wondering what folks' thoughts are in terms of are we now more susceptible? And do we have any sort of period of time like that had increased susceptibility for the other variants? I'll leave it at that. Thanks.
Kaitlin, would you like to comment on that? And I'm so sorry to hear after all of this time of staying safe, trying so hard. I know this has been the case. I've gotten phone calls too from friends in the same situation. So our heart goes out to you, and I hope you get through okay.
Thanks so much. Just encouraging other people, don't let your guards down. Really, like COVID loves our wishful thinking.
I'm also so sorry to hear it. So I can add a little bit here. So first of all, as far as isolation, we do recommend the gold standard, which is longer than a lot of the public health minimum requirements. So we recommend a gold standard isolation period of 14 days as a minimum, and then also resolution of the symptoms, as well as 2 negative tests 24 hours apart to exit isolation. I'm really glad to hear that you're planning to have your daughter test negative before attending this camp. It's really hard to know the specific individual risk, and I would say it's really important to be in touch with your daughter's pediatrician and to see how she's doing before she goes to that camp, because you would really want her to be completely and fully recovered just from a good health standpoint. The other thing is that we do know that repeat infections do have an additive risk of long COVID, and long COVID does affect children. So it is important to avoid reinfection. So I think it would definitely be worth looking into what precautions are being taken at this camp, and see if there's anything more that can be added to further reduce her risk of infection if you do want to send her.
And Heather, I would also like to personally invite you to join our community. If you go to our website, the World Health Network.global, there's a contact us form. If you just fill it out, and one of our greeters will get in touch with you if you would like support. We have meetings every day. It's a really great community. I've gotten so much support here, and I welcome you to join us, and that might be helpful.
Thank you so much. Thank you to both of you.
Thanks. Jill, would you like to ask a question?
Yeah, I actually have a question for Dana. Given the nature of her book, Dana, I'm just wondering if you can tell us about COVID, and is there any hope in terms of understanding what causes it and hopefully how to treat it?
Hi, Jill. I love that question because I am actually very hopeful about this. And I am very sad to see the incredible despair among the long COVID community. I understand it completely because, as you know from reading the book and maybe hearing me talk today, I went through a very similar horrifying, sudden train wreck of a chronic illness a few years ago. And I did recover. What I would say, one thing that isn't talked about that much is what is causing long COVID. I don't know that everything has been borne out at this point. But I do think that one really important thing to talk about is that COVID can be persistent, but it can also activate other latent infections. We hear a lot about EBV. We hear a lot about varicella, shingles, being reactivated in people who had COVID. I also think there are a broad range of other infectious diseases that can be latent and can reactivate in the face of COVID and in the face of other infections that should be looked for. I have heard from multiple over the last couple of years, many patients, or last year especially, who have gone on to treat other latent infections that were activated by COVID, and they got improvement. I think people should, vector-borne diseases are very, very common. People don't realize how common things like Lyme and Bartonella are. People don't realize how ubiquitous EBV is in the population. And people don't understand that so many pathogens that we think that we have cleared, we may not have cleared. There's a lot of studies and Amy Prohl, a microbiologist, has given me just the most incredible education about what pathogens are found in tissue. Rudy Tanzi from Harvard, who looks at brains, and Robert Moore, his deceased partner at Harvard, who also very brilliant scientist looking at tissue and looking at all the microbes that we have. So I do think that addressing some of these is really important. And one thing I should say that was true for me and true for a lot of long COVID patients and people in the ME/CFS community, they'll all tell you, rest. When you are tired, rest. The best thing you can do for yourself when you are going through this. I don't agree with this concept, this notion of pushing through. I think it's a dangerous game to play. The best thing you can do is rest and take very good care of yourself. Stay home. Test out of isolation. You don't need to keep spreading this thing around, but you also need to recover. We need you in this fight, all of you. I don't want to see anybody needlessly get sick and regret the moment that they had to turn it around. And that is early on. People start exercising and running, I think, and doing all these things. Going back to work too soon, I think that can make things a lot worse. And I know a lot of people will tell you this. So I just want to say it as well. It was my experience also going through this. I had my doctor, Dr. Phillips, who I wrote the book with, and then I had a Chinese medicine doctor named Dr. Zhang in New York. And I got very specific advice from each of them. And some great advice that I got from Dr. Zhang was exactly what I'm telling you. Also, watch dumb shows on TV. Don't be stressed. Don't get in Twitter fights. Okay, that's really not good for your immune system, I promise, whether you have COVID or not. Keep the peace. Watch things that don't aggravate you and stress you out. This is a very difficult time, and I would just say, I do think, going back to the causes of long COVID, I think there are probably multiple causes, but I think a huge one is persistent infection and infections, and I think that they will ultimately be able to be addressed. I'm not even sure that Paxlovid won't have a role in that ultimately. Like longer courses may be able to clear these viral reservoirs. I'm not the only one.
I think we just lost your sound, Dana, or maybe you finished. Okay. Let's move to Brian, and then after Brian, we'll have Solomon, and then John, and then Kenneth. So, Brian, if you wouldn't mind going ahead.
Sure, yeah, a short question. I would like to visit my parents who are they're getting up close to 90, and that means that I would have to take a flight on an airplane of approximately 5 hours to get there. And of course, I don't want to get COVID myself, and I don't want to give it to them. Have you any thoughts and advice?
Kaitlin, do you mind taking this one?
Yes, I can talk about this. First, I will point you to our travel guideline. Our travel guideline at the World Health Network website has a lot of details that can help you plan a flight that is safer. Travel includes a lot of risks, and I won't say that you can eliminate all the risk, but there are a lot of risks that you can reduce in the process of travel, and it's really worth thinking about really all of the details and kind of planning out. Can you get more direct flights? Do you have long layovers? What are you going to do for eating and drinking and all those things that you're doing in the process of travel? The other thing that I would say is if you can take a longer trip where you can isolate for a period once you get there, that's also a possibility, just in case if your travel ends up more risky than you anticipated, you have some unexpected exposures. We've been hearing about people who've had a lot of difficulty wearing the best mask that they have available through security and on their flights. So this isn't common, but it can happen. People can be asked to remove their mask, and you do have to briefly remove your mask, at least in the US, to go through security to verify identity. So there are definitely some risks, but those can be reduced. You know, thinking when you do gather with your parents, thinking about those 5 pillars of protection and how you can incorporate those when you're there into the gatherings.
Thank you. You guys are great. Appreciate all you're doing.
Oh, thank you. Thank you so much. Solomon, you're up next.
Hello. My name is Solomon, and I have COVID right now. It's the first time I've had it, and I tested because I had a sore throat all day. I didn't test immediately when I had a sore throat because I just figured acid reflux. But then, you know, it was a whole day, so I tested, and it was positive with the rapid test. And so that means that I have COVID, and my question, and I'm not immunocompromised, but I just was wondering about. I've heard conflicting things with regard to what does the infection do in terms of immunity for not, and I want to be clear. I'm not talking about immunity as in like in the clinical sense, not in the colloquial sense. Is your is your immune system protecting you more against subsequent infections of COVID after you recover from one, or is it protecting you against less because it's weakened your immune system? I'm just wondering about that. And the other thing that I'm wondering about, and I'm sorry, I'm fitting in 2 questions, is about contact tracing. I just tested today, and this is the first time I know that I had it. On Monday, I went to lunch with my uncle at a restaurant indoors. So I talked to him. I talked to the restaurant. But on Sunday, I went to a protest that was outdoors, but I had my camera, and I have trouble with the viewfinder getting fogged up, and I have a way around that, but I didn't think it was even necessary because I'm outdoors. So there's that. And then on Friday, my sister came over, and we tested before then. I tested negative. But my sister came over from Canada on her way back to her home in Baltimore, and with my nephew, who's less than a year old. And I was wondering whether I should contact my sister and let her know, and because I don't know how long I'm supposed to go back.
Who would like to respond to that one?
can start, and then maybe Dana can fill in some more. I mean, I really appreciate, Solomon, how conscientious you're being in trying to contact people that you may have been around. And I'm sorry that you're in this situation. Really, this is not right that we're getting exposed to this virus. We ought to be able to be protected in this infection. I hope that you recover well. So as far as the immunity question, this is a really hot topic, and it's something that's very misunderstood. You'll see people with a lot of credentials saying the wrong things about this. And really, I think the latter part that you said was correct. So that COVID actually has a damaging effect on your immune system. There's emerging evidence about this. We don't know all of the details yet, but it's likely to be reinfected. We're seeing this that people are being reinfected quite quickly after they've had an infection. And and then, as Dana mentioned, the reactivation of latent infections and other increase susceptibility, which is an important thing that is a potential effect of COVID. So it's definitely really important to increase protections if you can after having had this experience. And I hope you recover well after the isolation. I will mention again, we have a couple of different isolation guidelines. One is on the isolation timing, and that's what I mentioned. We recommend, the World Health Network recommends a 14-day gold standard isolation period to prevent spreading the virus to others. So it's not just 14 days, it's a minimum 14 days with resolution of the symptoms, and then having 2 negative tests 24 hours apart to exit isolation. And then the question on contact tracing, I really appreciate this. I would say, if you're comfortable using social media to potentially contact people, if they were in this protest situation with you, that could be an effective way. But I'll send it to Dana for any additional suggestions and support.
Yes, I'm so sorry to hear that you're going through this, and I'm wondering if you're getting any early treatment or if you considered it, and maybe something to think about, to talk to your doctor about. We have monoclonal antibodies that people are still taking that are helping. Also, people are taking Paxlovid, and there are other things. There are other more over-the-counter things people are taking to help them through this. I'm just really sorry that you're going through this, and I hope and pray that you do not get long COVID, and that in the future, I would just protect yourself from future infections, because none of us can possibly imagine. If you get off easy on this one, awesome. Take the money and run, and just try to keep yourself healthy as possible. And my Jewish motherly advice is just please rest and take really good care of yourself. And do please talk to your doctor about what you could do to shorten and lessen the extent of the illness, because there are really, really good things.
What's ironic is that my doctor moved to Florida in July, and I got referred to a new doctor at the same practice, and my appointment was on Tuesday, and I forgot it happened. I forgot to look on my calendar. Although I was at the clinic waiting in the pharmacy with a mask on Monday, but I did not go on Tuesday to my doctor's appointment. But if I had, I could just be I could have just been spreading it as not getting treatment, because I didn't know at the time that I had it.
Yeah, I understand. Yeah, and the timing is really tough sometimes, and but it sounds like you're doing everything you can do right now, and that's all anybody could ask.
Yeah.
Yeah.
Okay. Thank you.
May I get a little bit clear, please? Hello.
Hi,
Yeah.
yes. One second. We're just gonna move to Yanir's comment, and then we can move
Okay.
to you next. Thank you, Professor.
Okay.
So thank you all. It's good to hear the conversation. It's great. I just wanted to add quickly, because it wasn't mentioned. I don't know if you said it, but you should surely tell your uncle and your sister and anybody that you were with directly about what's happening, so that they will take appropriate precautions at this time. This is the most basic part of contact tracing. They're your contacts. You may have been infected by your uncle because it was earlier, so you may want to let them know that that's also a possibility. They may have developed symptoms if you haven't been in touch with them, so you might want to talk with them and find out. But regardless, they may be either at risk of infecting other people or having been infected, and you should let them know that those are possibilities.
Great. Thanks, Yanir. Dana, did you want to add to that?
Thank you.
You know, I wanted to go back to the flying question because I talk about it with friends and family a lot because there's a lot of travel and there's a lot of COVID going on, and they seem to not like each other too much. Um, the virus really loves it when you get on a plane with no mask. I can tell you that. So what I want to say is that the way I would do it, and I've talked to so many scientists about this, and I feel really comfortable saying what I would do and hoping I'm doing all the right things. I would up my mask. I would minimally wear an N95 maybe for a very brief flight, but I actually really would rather wear a P100, wear a respirator. I've learned so much about this from Nicholas Smith specifically. I'm so grateful to all the scientists who have spent time educating me so that I can help other people. He's so wonderful and brilliant. So I would say I would wear an elastomeric. I would cover my eyes with either glasses minimally or goggles. You can get less embarrassing looking goggles by getting the ones that look like glasses and they have like plastic on the sides and you don't feel like such an alien. But I really wouldn't take it off from the minute I set foot in the airport to the minute I set foot on the other side. I wouldn't lift it to drink. I wouldn't lift it to eat. I would try to avoid going to the bathroom as much as I can because they're not well ventilated and COVID spreads definitely in bathrooms as well. So that's my 2 cents. I think you can really stay safe if you do that. And I know many people who have, but I also know many people who haven't, thinking that a surgical mask or a cloth mask or even a KN95, which now doesn't seem to really cut it a lot of times in a poorly ventilated plane. I've heard a lot of people getting infected with those. So I would say upgrade, more is more, and rock it. Don't be embarrassed, because if you have a nice, healthy vacation, you're going to be much, much happier. Or a nice, healthy work trip, you're going to be much happier. And that goes for me for all indoor activity. Don't take your mask off for a second. Because as Heather said, she had one moment where she let her guard down and now she and her family are sick. It doesn't take much. So that's my advice. And I would say the same thing for moving. Somebody had asked a question about how to safely move. I moved during the pandemic a couple of times. It wasn't fun, but I did it exactly the way I'm telling you now. It's really just all common sense stuff. I kept distance from people when I could. I always had on an N95. I let the house clear out before I entered. And for a couple of hours, I opened all the windows and the doors. I set up a HEPA filter or two when I could. And that's just how I did it safely. And I managed not to get COVID. Driving across the entire country, staying in all kinds of hotels and Airbnbs, and then subsequently moving within California a few times. It can be done.
Thank you, Dana. So, Kenneth, I appreciate you being patient. So you can go ahead next with your question.
Hi, thanks. Yeah, I kind of came onto this, it just popped up on Twitter. So I was really grateful because this is a huge interest to me. I missed some of the early content, so you may have already spoken to this. I am immunocompromised. I have 3 autoimmune disorders, and I'm on an immunomodulating drug. I'm fully boosted, and I'm 66 years old. So I did convince my rheumatologist to give me an antigen test. She didn't think that I would have any issues. I did get mildly sick with a couple of the boosters. And so I had assumed that I was developing antigens, but the test came back showing negative. And I'm hoping that one of you might be able to explain exactly, does that mean I've never developed any antibodies? And my second part of that question is, I did get the Evusheld monoclonal shot. And I'm wondering, is that going to provide a similar benefit as if I were fully able to, reap the benefits of vaccines?
I can take the first part of this. I know that Dana actually recently shared with us some information about Evusheld, so I'll let her share that at the end here. But as far as immunocompromise, as you know, immunocompromise varies a lot, and I'm glad you were able to get an antibody test. Those are tough to interpret, but you have a good idea now that you probably weren't protected by those vaccines, that you did not develop an antibody response to them. And I'm glad that you were able to get Evusheld. There are some changes with Evusheld and the most current variants, and I'd like to leave that to Dana to talk more about.
Oh, thank you. I don't have an incredibly deep knowledge of it, but I did see some data recently. There was an article, I think, from the Lancet that said that Evusheld is less effective. Unfortunately, it's like I think it was like 20 times. Just I'm not 100% sure, but I'm pretty sure it was 20 times less effective against these variants. However, there was another study that said that if you take it early in the illness, it can also reduce the severity of illness. So it's some conflicting data. There's probably other people here that can comment on it further, maybe Yanir, or Eric. But I think it does still seem to me like a viable layer of protection for those who need it. I would definitely not discourage anybody from getting it. I do know a couple of people who have gotten breakthrough COVID symptomatic cases through it, but I know a lot of people who have been helped. So, it's like with everything COVID, nobody has the same experience twice. It just seems like it's kind of, there's so many unknowns, but, I think it's worth considering that it can help.
Thanks. Just for clarity, then, so the negative result on that test would infer neutralizing antibodies, or would it be T cell activity, B cell? I'm not an immunologist, so I'm not really clear on all the terminology, but it seems like I had some response by not feeling well after getting 2 of the boosters. So to me, a negative test seemed confusing, but you're thinking negative just means negative. There were no antibodies developed at that point.
I hear you on how confusing this can be, and I would definitely, it sounds like you're getting good care from your doctor, and the individualized questions are definitely important to discuss with your doctor. But as far as antibody tests versus T cells, we don't have a way to measure T cells, but actually the antibody tests are the gold standard for measuring a vaccine response in most cases, but there is no clinical standardization in those antibody tests. So there is variability. It's definitely worth talking to your doctor about the specific tests that you received and how to interpret those results.
Okay.
But it is definitely good and important to continue taking other precautions because you may be at higher risk. Thank you.
Thank you very much.
Thank you. Professor, would you like to go ahead with your question? Thanks for your patience here in the queue.
Yeah. So just I wanted to add a comment. It's not a question actually. Just because some gentlemen asked a very nice question whether one variant or one kind of subvariant of infection is protecting from COVID, other subvariant or variant. So I wanted to comment on this. Yes, in few cases, no, such kind of protection depends what kind of similarity is among those subvariant and variants. So B1 and B2 had some kind of, I would say the better similarity. So we could see that some kind of protection after vaccination was existing. But since BA 2.75, which is very much circulating in India, BA4 and BA5 in Western population currently, there is more immune escape. So I will say it all depends what kind of variant and subvariants are there. So no generalization can be made on this, and this also depends because we have very much different genetic background, and our immunological responses are not same in individual. So there cannot be any blanket comment. And another thing, as it was very nicely suggested by someone that. we we have actually put down our guards of protection in various parts of the world, whether it is Western or Asian, because it might be due to COVID fatigue. I can understand people are now very much tired of this, but as somebody suggested, yes, it's very important not to reduce this our guards, because still sub variants are circulating in population, and now scientists are talking about Omicron specific vaccines. Up to some extent they could be effective, whatever reports are coming, but as you know, it's very difficult to chase the moving target. So as we will be reaching to the BA1, BA2, we have now BA4, BA5, so I don't know how long and how far we can have these variant and sub-variant specific vaccination. Yes, now there are discussions about mosaic vaccination, which is a kind of pan vaccination, but still it is in fancy. I would say a hope is still existing with the mucosal vaccination, which is where studies are going on, where we can see that block the virus at the port of entry, and that is through your nasopharyngeal route where mucosa is there. So yes, we need to protect ourselves. And what my maximum worry currently, on one hand we are having a RNA virus, that is SARS-CoV-2. On other hand, we are seeing monkeypox coming on the way, and that is DNA virus. So I don't know how much immunological inserts will be there to the immunological system. This is something actually challenging. Thank you very much. Appreciate.
Yanir, can you comment?
Sure. Well, thank you very much. I think you've summarized some things very well, and it would be great to have your participation with the World Health Network. But let me try to add a few words for clarity. So one of the things that people really are not aware, right, is that maybe an analogy is we have a military confrontation now going on. So an immune system in some sense is like an army, but the fact that you have an army doesn't mean that you will win the war, as we know, and doesn't mean that the army may not be damaged as a result of the war, and that will cause harm to the system in a way that will lead to difficulties in other contexts, in other conflicts. So we have a very simplistic, often view of the immune system that suggests that it will be victorious, and as a result of being victorious, it will be stronger. But that's, of course, not always the case. And in particular, the genetics that you're talking about of variants can influence the effectiveness of the immune system and its response in wildly different ways. So what we have, for example, is that we have two subvariants, which are very, very different genetically, BA1 and BA2, and yet, at least superficially, it seems like they're not so different from each other, but in fact, they are very wildly different from each other, and their effect is not the same. And BA2, of course, overcame BA1 over a quite short period of time and became the dominant because of higher transmissibility. And now we have basically three other variants that have become progressively dominant over time: BA 2.12.1, and then BA4 and BA5. Interestingly, those variants are not that different from each other genetically, but they have sufficient difference because of key mutational differences that enables them to bypass the immunity. And in fact, BA4 and BA5 in particular have a much greater immune evasion from both vaccines and prior infection than did even BA1 and BA2, which themselves were much more vaccine evading, as we know, than any of the previous variants. So sometimes a key mutation can make a huge difference and have a very large effect on transmissibility, on immune evasion, as we've seen with BA4 and BA5. And sometimes you can have very large differences that have a comparatively similar or different, if you will, but not necessarily as large as the genetic difference would seem to indicate. So these are some of the things that play a role. And I do accept also your statement that we are, with these multiple pandemics that are going on, including COVID and monkeypox, we are at risk for having the potential harm to the immune system from one of them, specifically COVID, causing a significant impact on the transmission of the other, i.e. monkeypox, and perhaps other diseases. And in fact, we've seen indications that there are a variety of other conditions that are rising around the world that seem to be unusual in their behavior and may have, we don't have confirmation, of course, for all of them, but may have been impacted by the effects of COVID on the immune system.
Thank you, Yanir, and thank you, Professor, for joining us this evening. And we would love for you to join our community. You could DM us here on Twitter or contact us through our contact form on the website.
Thank you. Appreciate it.
Absolutely. Thanks for coming on. All right, let's move to John O. Go ahead, John, with your question.
Hi there. Thank you for this space. I'm coming from New Brunswick, Canada, and I guess I'm one of the people sort of struggling. Somebody mentioned earlier struggling with hope on all of this. I know Canada sort of, our impression of how we were viewed in the world is that we were handling things quite strictly, and it certainly doesn't feel like that now. All of our provinces have essentially gone away with all measures. And my province in New Brunswick, actually only 2 provinces in all of Canada require you to isolate if you have active COVID now. And so I guess my question I'm trying to get to is what to look to for hope. Like in Canada, we can't have Paxlovid unless we're 65 or older. Monoclonal antibodies are not readily available to us. We just approved under 5s this week, 5 and under this week for vaccines. And so there's really not a lot available to us. I know a lot of people are pointing to studies that, if you have an active infection, there could be some benefit to taking an aspirin, to taking an antacid and an antihistamine daily. We can't get Innovid here. It's not approved in Canada. We always seem to be the last ones to do that. So I guess we often look to the States for hope. And I guess one of the questions I have, like the main question I have is, I know when COVID started, there was this massive movement of funding to get the vaccines, to get them up and out and as quickly as possible. And I'm wondering, as governments now sort of try to do the urgency of normal and have done away with protections, is that funding still there? Is there funding into long COVID? Is there funding into updated vaccines or neutralizing vaccines? Or is it just the same as the protections? It's all kind of gone away.
Dana. I think there's something going on with your sound because I don't hear you. So if you want to unmute. Okay, so Dana's having a little connectivity issue. So Dana, I'm going to ask you to sign out and sign back in. And Kaitlin, if you want to pick that up, otherwise we can skip to the next person and come back to John.
I would love to make a brief comment while Dana's getting back in. And
Great, thank you.
I would love also for Yanir to say something about this because he's always incredibly inspiring to me. So, really the things that I see hope in are in actions. And we don't need a new innovative silver bullet to kind of get through this. We have a lot of effective measures that we can use. We do need funding, we need government action, we need support for people, for example, to be able to stay home when they're sick, and all kinds of things that only the government can do to impose protections so that people can safely access the things that they need to go about their day. But we also have individual power. And we have power even more so when we gather together, when we find community and support with each other so that we can all keep doing what we're doing, keep taking precautions. We can all improve our precautions. These individual actions do make a difference. And then the collective actions can even amplify that more. So, groups like in the San Francisco Bay Area, Senior and Disability Action, groups that are really making an effective stand to protect the people in their communities. Those things give me hope. There have been successes, we tend to focus on the things that are going wrong. We can see those things, we can see those things need to change. But that's a big reason why I joined the World Health Network, is to take action so that I'm not just doom scrolling and turning this problem over in my head and feeling very powerless about it. We can all feel empowered with the actions that we have available to us.
Thank you, Kaitlin. Dana, how's your sound?
I think it's okay. Are we better now?
We're good. You're coming in crystal clear.
I'm sorry about that. Anyway, I thank you so much, Kaitlin. You always say all the right things. I would just add on, I was an early proponent of early treatment, and I'm still a proponent because I do have hope that early treatment will reduce the risks of long COVID. I know that we don't have all the data yet, but it stands to reason that when you treat infectious diseases early, you get better outcomes. That is very, very standard in most diseases. So it's really been weird to see the length of time it's taken for people to start really talking about this. But in terms of you guys not being able to get Paxlovid and not being able to access monoclonals easily, there's still other things you can consider. There's a doctor on Twitter that you can follow, a wonderful researcher named Angela Ryerson, who studies fluvoxamine. That is a cheap generic old drug that you can get, that has some activity against COVID, that has good data. You can look at that. Melatonin, bromohexine, all these things are published to help. So if you can't get Paxlovid and these other things, I don't think you should think there's absolutely nothing. There are doctors here that are using those drugs along with the more expensive, fancy things that we can't all get hold of. I know many patients who have done well doing those kinds of things. So I don't think it's hopeless at all. And I think there's going to be more and more therapeutics that are going to be coming onto the market that are going to be helping people with both COVID and long COVID.
Thank you. Kaitlin or Yanir, do you want to add anything before we move through?
So I would just add and reinforce some of the things that Kaitlin said. And I think that it's important not to see the current situation as the persistent situation. In other words, from the beginning of the pandemic, before the pandemic, people seem to think that their world couldn't change. There's a pandemic coming, but there's not needed to do anything because the world won't change. And then once the pandemic was wherever it is, then there was a belief that nothing would be able to affect it, or that the current situation wouldn't be affected because if there were there wouldn't be a new variant. Now, but then there was new variant, and then again, the idea that somehow things don't change hasn't been the right perspective. And in terms of the situation in the society today, I really see that there has been this progression from an early action stance to the idea that the vaccine-only strategy would work, and then once the vaccine-only strategy didn't work, there was some new actions, and then there was abandonment of all action. Basically, even the vaccine is not being emphasized as a societal solution, and indeed, it's a limited effect. And the question is, what will happen in a few months? And one of the things that I would point to is that there is a structural failure of action. And we see again, as was said at the very beginning of this presentation, some of you may not have been here, that there's reinstituting of mask mandates in some places in the country. BA4 and BA5 are driving an awareness that we cannot just do nothing. It's not working. And of course, there's a huge, huge pressure to do nothing. So the fact that people are beginning to do something is pointing to the severity of the failure of that idea. So if doing nothing is not a solution, what can be the solution? And the answer is really the only thing that can be done is actually to take substantial action. But we have to build the experience with successful actions. And so whether it's at a local community level or at a family level, the opportunity is available for us to demonstrate to ourselves and to others that by actions protect ourselves and others. And if we can do that and spread that as the alternative to doing nothing, I do think that there is a tremendous opportunity in the next period of time to shift the conversation in the direction that will really solve the problems. And whether or not, right, if we are fortunate and there is a new vaccine or a new treatment or other things that will help us solve the problem, we have to recognize that the main thing is that we have it in our hands to make that difference. And that's the way forward.
Thank you, Yanir. Kaitlin, any final comments regarding this topic?
Yanir is a very tough person to follow because I feel like that would be an excellent note to end on. I just want to thank everyone who's joined this space, everyone who's out there, whether you've joined our communities or not. I really encourage you to join our Twitter COVID precaution community if you haven't already. This is a great way to take advantage of the hive mind. So to really get some input and to also give and receive support. So people are there to help. Everyone who's there is taking precaution, and people really have some creative solutions and ideas to share with you, and as well as just that community and support. When I think about this from a medical perspective, we are very focused in the U.S. and apparently in Canada too, somewhat on treatment rather than prevention. And while I really hope that innovative treatments will come about, and we have some treatments already available, you should definitely talk to your doctor before starting any new treatment, whether it's prescription or something over the counter. We don't need to wait for those treatments. We can prevent infection using the tools that we have today. And I hope that with this discussion that you can be inspired to take additional action, share information with your friends and family, and spread that support outward.
Thank you so much, Dana and Kaitlin, for coming on and spending your evening with us. And thank you, Yanir, for hopping in. And thank you, everyone, for joining us tonight, asking questions. We've gone a half an hour over than planned, which just is a signal that we were having a terrific discussion. And we will be having more Twitter Spaces very soon. We also meet every day at the World Health Network on video call. So if you want to ask a question to Yanir or Kaitlin, myself, all of us, we're available. We're here to chat every day. We have meetings multiple times throughout the day. So join us, worldhealthnetwork.global, contact us, and someone will get back to you and we'll get you started and hooked up into the community. Please stay safe. It's really rough out there right now, and do your best to stay strong and support each other. I know it's not easy. Thank you again so much, everyone, and have a wonderful night. Oh, before we leave, I would like to invite Dana and Kaitlin to add a few more comments if they have anything else they'd like to talk about.
Sure. I'm happy to start. This is Dana. First of all, I just want to.
I can't hear anything.
Oh, you can't. Can you not hear me?
I can't either.
You can't hear me? No.
I hear you, Dana.
Sorry, we're having a little bit of technical difficulty here at the
How
end.
about now? Can you guys hear me now? Sorry about this.
Yeah. Go ahead, Dana.
I'm sorry. I just had so many technical problems tonight. I apologize. I thank you so much for having me. I love being part of this network. I've learned so much from all of you. I'm honored to be in your company and in your presence and to be able to call on you and ask you questions so that I can spread them forward, pay them forward. And thank you. And Yanir, you've been such a special support. And I really, really want to say thank you. And to Kaitlin, my co-host for the night, and Katie, you guys are incredible. The one thing I didn't say, and I'm sorry that I didn't say it earlier, and I hope there's still a couple stragglers on here listening, is that I wrote a book with Dr. Stephen Phillips. I co-authored a book called Chronic, The Hidden Cause of the Autoimmune Pandemic and How to Get Healthy Again. And one thing I did not say is that infections can cause autoimmune diseases. And we're seeing that on a global stage with COVID. And this has historically also been true, but nobody really recognized it. There's tons and tons and tons of data. We talk a lot now about EBV causing MS. Well, many other infections also cause MS. Lyme causes MS, and EBV causes other problems, chronic fatigue. So I think that we have to look at infections as a root cause of disease and stop passing patients off on the medical merry-go-round for their entire life on drugs that only quell their symptoms. I think we really need to focus on root cause. I definitely feel strongly that COVID is because we know now we have almost 300 studies that demonstrate it's persistent. It can be persistent. We have to look at that as a driver of symptoms, as well as other mechanisms that other people can talk very comfortably about as well. But I can talk to you very much in depth about infections and how they cause a wide range of autoimmune, psychiatric, and neurodegenerative diseases. We're seeing this with COVID. Please don't discount root cause. Please ask your doctors to be tested for a broad range of infections when your body goes haywire, things don't feel right. Even if it's a little anxiety and a little depression, infections can cause that too. And brain inflammation causes all kinds of neuropsychiatric diseases. Don't be ashamed. It can be very shameful to talk about these things, but there is a lot of hope. And I wanted to say to the long COVID patients, I absolutely have hope that you can get better. Please don't give up. I know how hard this is. Advocate for yourselves. I know that you don't get heard as much as you should. And I know that you're being told it's in your head. I know it's not in your head. I know that you are truly suffering, and don't let anybody take that away from you, and don't let anybody tell you that you're imagining things when you're going through a really serious illness. I know that there will be hope and help for all of you. Hang in. It is hard. I've been there and I got through it and I'm better. So I'm here to tell my story and to thank you for listening.
Thank you so much. We love these messages. We love the hope. And again, we are at worldhealthnetwork.global, and you can join our network using the contact form on our website. Please stay safe, everybody. And again, thanks for joining us. Have a great evening.